late. I'll go get my son. Good night.
Stay. I want someone to talk to.
Yes, Mrs. Amyx.
If you love listening to this show, please consider giving a rating and a review on Amazon Alexa or wherever you listen. We want to continue bringing you this amazing content, and part of our ability to do that means that we need a big audience. Now, it may not seem like much, but rating and reviewing the show will help more people find us, just like how you found this show. Simply on any podcast platform, search for a show, scroll down to the bottom, and push 5 stars. It's that easy. Thanks for supporting the show. Joined by Ellington West, who is the CEO and co-founder of Sonavi Labs, the creator of Feelix, a noise-canceling, audio-enhancing smart stethoscope. So thank you and welcome to the show.
Thank you. It's an honor to be here.
So very interesting background. Your father is Dr. James West, very well-known inventor, professor, who, back in 1962 developed the electric transducer technology that's now used in, I guess, some 90% of the contemporary microphones. Is that right?
That's correct. Yes.
And it's, it should be also noted that, again, this is a time period when, civil rights was, very much at the height of it. And, here we have an African-American inventor and a scientist. So that's an incredible, beautiful story. Is there anything that you want to just kind of call out or share with the folks that are listening?
Yeah, I think that when you take a gander back at what society looked like in the 1960s, and to have an African-American man who grew up in the Jim Crow South, for him to really transform telephony, I have to say, has not only been such a marker and roadmap for me as an entrepreneur and innovator, but it let me know that there was really nothing that could stand in my way when it comes to being successful or really striving for any dream that I might have it in front of me. So I think that he certainly served as an inspiration for me personally. But when you think about the acknowledgement and the way that we celebrate African-American scientists specifically, I think that it is far and few between. And as a society, we do have to do a bit of a better job, because there are so many students and young innovators behind us that are looking for role models in a lot of ways. So I'm incredibly proud of him and the work that he's done. But I definitely think that in STEM in general, we do have to transition how we prioritize that as a nation.
Yep, I couldn't agree with you more. And I think role models, especially these days, is so important. And I think part of role models also is just not only looking at modern time role models, but also historically looking back at people that have, in very difficult kind of societal times, have still risen to create profound, novel solutions and innovations for society. Mm-hmm. I want to talk a little bit about your background. You were trained in poli-sci, psychology, mm-hmm. and I guess to what extent has your father's work influenced you into going into what you're currently doing in terms of stethoscope and,
sure.
and the sound that our body makes in terms of using that to diagnose diseases?
Absolutely. Yeah. So it's really interesting when you think about my training for an undergrad experience. I think that we kind of throw that out of the door and we focus on really the practical experience thereafter. So, the transition for me right after undergrad, I spent a lot of time at a market research firm, really understanding the motivation behind why customers, specifically in healthcare, buy, right? And then I transformed that into, I was building sales strategies for national healthcare companies and was poached by one to then become their director of sales. So for me, the transition really happened when Jim came to me, my father, and said, here's a tremendous opportunity. I have this technology that I've developed that I know can save hundreds of thousands of lives. But like so many technologies that are developed within university doors, they live and die in the lab because there really isn't that intersection of business or commercialization to carry it forward. So I obviously had the rubber meet the road in my experiences, successful track record, being responsible for over $150 million of revenue annually. I knew how to take a product to market, specifically in healthcare. So it was that moment where I knew that more needed to be done. And so I never intended to be in the med tech space, but it would have been a disservice for me not to leap in headfirst.
I think that makes a lot of sense, and now we have a better context of how that transition occurred.
Mm-hmm.
And when we think about stethoscope, we think of this kind of ubiquitous device that doctors wear, and for us patients, it feels cold and foreign, and they listen to our bodies with it. It's a very kind of strange device. It's again fairly commonplace.
Mm-hmm.
How are you guys using the technology, underlying microphone technology, to listen in, and what are you listening for?
Great question. So when you do think about a stethoscope, it is a badge of honor for a physician. It's one of the first things that they get when they cross over into that space of, I'm now a practicing doctor or practitioner. And so as that badge of honor exists, and the prevalence of it in medicine being the first line for diagnosis, for us, it was about augmenting it in a way that would allow anyone to use it. Because really, when we started this project, we were focused on community health workers in low and middle income countries. So we weren't even thinking about clinicians at the time. We were thinking about empowering anyone to have a device in their hand that would listen to the sound of your lungs very similarly to a stethoscope. But instead of requiring a physician on the other end to listen, the AI on board was doing that work for you. And so while the stethoscope is probably one of the most cost-effective tools when it comes to diagnosis, they still require the expensive component of a provider, right, on the other end. So for us, it was how do we enhance the capabilities of such a powerful tool and really give it the upgrade that it needs for the 21st century?
So again, let's have a baseline and then compare it to what you guys are doing. Is
Yes.
What are doctors using in terms of just kind of the rudimentary device, and how are you guys looking to supercharge that? What exactly is the delta improvement?
Sure. So right now, we already know that there is so much subjectivity in auscultation, who really remembers what they heard a second ago? And for us to rely solely on what we hear is a dangerous thing if you don't have a second layer of confirmation associated with it. So for us, with a traditional stethoscope, the physician is listening in real time, making a classification. With Feelix, they're listening in real time, but they're also getting a layer of confirmation that confirms that, yes, it is pneumonia. Yes, it is asthma. So it's just helping them differentiate these crackles and wheezes. And this is important because often when you're specifically dealing with a pediatric patient, you're inclined to hear the pneumonia in the lung, but then send out for x-ray. And we want to eliminate the need to send out for x-ray. We want in real time, within 10 seconds, to have a second layer of confirmation right then and there. We also see that providers want to be able to review the lung sounds of their patient to understand the efficacy of treatments. So what they're doing is we're building into the EMR system. So all of our devices are compatible with any EMR system. So what that physician then is able to do is look back on all of those recordings of that patient, track their trends, understand when they're getting better or worse. So right now we know that we have x-rays compiled if you were recovering from a broken bone, but why shouldn't you have the same for your respiratory health and monitoring it along that way?
So just to be clear, in terms of the data visualization, the dashboard component, are we saying that these are audio files, or these are audio files that has been depicted into graphical forms that overlays to common diseases to give that confidence degree in terms of what this could be, diagnosed as.
Yep. So the provider is actually provided with both of those. So there's a visual component as well as an audio. And that's really important when we're moving outside of clinic and we're thinking about at-home capabilities and the telehealth components of medicine also. If we're recording, we want to be able to telemeter in real time the most quality data that we can extrapolate from that patient. And that is something that we were really focused on, was not only supporting providers in clinic, but really supporting their patients outside of clinic.
Can you talk about the data sources I was used to train? So, I think in terms of classifications of the potential issues around the lungs, for example, there could be a myriad of things. So, to have enough of pattern recognition and predictability, what's the data sources that you use? How did you guys go about training the algorithm to figure out the fit?
Absolutely. So we were fortunate enough to be supported by the Gates Foundation when the research started, and it allowed us to generate the largest pediatric respiratory database in the world. And so this algorithm was trained on over 1,500 pediatric patients in 7 different countries. And so what we did was that we took all of the data and recordings from those patients that we knew or we suspected had pneumonia. And we took a physician panel from Hopkins as well as an X-ray panel. And what we did was we trained the algorithm to identify the crackles and wheezes associated with pneumonia. And then from there, we did a listening panel with over 30 physicians at Hopkins. We then confirmed it with X-ray. And that's how we were able to validate the algorithm itself. And so while we're validated in pneumonia, we're working through other indications like asthma, COPD, and tuberculosis.
Yeah, and certainly for kids, pneumonia is a very significant, diagnostic capability to have as a starting point. And then I think, one of the things that I probably not enough people appreciate is that sound is a very rich medium. We're essentially talking about the electromagnetic spectrum. And in that, there's distinctive signatures that gives us clues in terms of what that could look like. I mean, you talked about crackles and different types of kind of these, signature noises, I suppose. And thank you for also sharing this notion of also the panel, the subject matter expert panels, and how that kind of played into more like a supervised ML, approach. So very, very interesting. I want to go back to the hardware a little bit. I think from what we understand, there was a, kind of the microphone array. Correct me if I'm wrong. If this is, I imagine this fairly off-the-shelf types of components versus really the IP being hardware per se. Again, correct me. Go ahead.
So absolutely, from a the real secret sauces within that software of the adaptive noise suppression algorithm and the classification algorithm. But we would be doing a disservice to not say that the design patent that we do have for the hardware itself does dictate a large component of the success of the accuracy of the classification algorithm, simply because the placement of the array of microphones on the bottom of the device with the one external microphone on the side are critical. Because if you can remember the last time that you were at a doctor's office, they're kind of looking for that sweet spot on the chest. And so with our array, it allows there to be reduced sensitivity so that any user at home or an untrained user can really get that quality reading without any extensive training or hassle. So a key component, but not nearly as important as the software itself.
Yeah, I think that's well noted. Certainly, all of us have experienced the doctor kind of placing it and trying to figure out exactly where's a sweet spot, like I said. So having enough array to really capture the full sound from different angles is going to be very important. The noise suppression, that's interesting. And I just want to be clear here. Is this dampening? So essentially, it's trying to get rid of the white noise, some of the signal noise, to kind of hone in on the specific signatures you guys are looking for?
Yeah, absolutely. And what's really important is to differentiate for people, because at times we think about we think of active noise cancellation. So we think about like our Bose headphones, and that if you're on a plane, you can hear that humming of the engine. But when you put your noise canceling headphones on, that humming is eliminated. But if you had someone sitting next to you on the plane and they began to speak, you'd be able to hear them speaking. What our proprietary adaptive noise suppression does is it learns and eliminates in real time those additional ambient sounds based on the frequencies. So we're able to, if you're at home and you have a crying baby in the background and something that an algorithm would have never been exposed to before, we're fortunate enough in real time to be able to control and suppress that. And that's another critical element when we're operating outside of clinic.
Yeah, so I think there's a general pattern in terms of how the lungs should sound. So it's really cutting out the floors and the ceilings and just really the outliers that could potentially create a data bias.
Exactly.
Okay. All right. Can you talk a little bit about, again, I know you mentioned some of the panel, expert panels, but any type of more kind of rigorous preclinical trial? And then you mentioned also other diagnostic categories or classification you guys are pursuing as well?
Absolutely. So we have 4 active pilots right now that we're really working on building evidence for additional indications. So we have an NIH funded study for asthma happening at Johns Hopkins right now, where we're focusing specifically on minority asthmatic patients, given the disproportionate impact that asthma and generally respiratory diseases do have on lower income communities and Black and brown communities. We're also partnering with the University of Antwerp. We're taking a really good look at the efficacy of treatments for cystic fibrosis patients. And what we're seeing is a very clear differentiation when we're taking them home and they're using Feelix. We can immediately see, it's not immediate, but in a quick, over a quick time period, we can definitely see what's working and what isn't. And that's been great so that clinical studies and trials for pharmaceutical companies haven't been halted as a result of COVID. So it's a great way for them to work in parallel. But something that we're very excited about is the monitoring of our post-lung transplant patients. What we're doing and what we've realized was that there was such a low compliance rate for these patients post-op because they had to travel such distances for their follow-ups that we were seeing a high failure rate in the transplants. But when we sent a Feelix home with those patients, we saw a dramatic improvement in not only their compliance with their medication and tuning in with their physician, but a quicker recovery time. So what we're working on right now as a team is really building the evidence that we need to support our payers and our reimbursement strategy. So I think that that's a critical component, that we are a research company at heart, and we will continue to work through pilots to just build the evidence that we need in all of these additional indications.
Right. And of course, some of this is going to get manifested in the form of peer-reviewed journals and articles.
Absolutely, yeah.
Right. Excellent. Yeah, I think I think you're really hitting on a sweet spot, which is that, aside from the clinical use within a hospital or a clinic, the real value is the ability to provide this kind of self-service, decentralized telemetry. And the more frequent they're able to do it, you get better information, real-time information going to the cloud. And then the ease, like you said, I mean, I think especially for low-income, marginalized, segments of society where they have to use public transportation, or maybe they're on a wheelchair, it just makes it much more difficult for them to get the kind of regular health and checkup and diagnostics. And here they can do it at the comfort of their home. Very interesting. Tell us about kind of your next key milestones ahead and what's next for you guys.
Yeah, for us, I think that it's about exploring additional indications and really knocking down as many doors as possible to get the device in as many hands as possible. So really, this is a time for us where we are scaling and growing exponentially. We have worked so hard to get the device where it is with FDA approval that we're just really looking forward to the hard work and rolling up our sleeves of ensuring that it does reach those patients that we set out initially to reach. And also just after we validate in all of our respiratory diseases. We have bowel sounds and cardiovascular sounds on the horizon, because what's so powerful about acoustics and what's so powerful about the AI that we've created is that we've already seen such positive results in exposing it to cardiovascular and bowel data that really anything is possible. So for us, it really comes down to focus and where we want to spend our time. And as we grow and we evolve, we'll really be exploring those other spaces.
Yeah, I think I couldn't agree with you in terms of focus, but ultimately it's interesting because our bodies generates electricity, various, whether it's EEG, EKG, but there is also thermal, right? So there's the kind of galvanic skin response aspects, and then the things that's inside our body. But the ability to have a non-invasive approach and use acoustic and sound waves to detect some of the vital organs, I think to me that's beautiful. And again, it's not as dangerous as things like X-ray, for instance, or as cumbersome as an MRI or CAT scan, for instance, as well. So really, from a triage, cost reduction, it really does have a place. I do think so, especially from a telemetry. Last question we always ask is lessons learned. Any type of product or project failure, including your father's, perhaps, maybe that others can learn from.
I'm glad that you mentioned my father, because while I would say that there are no regrets, I can say that one of the most valuable lessons that he learned and that I learned by proxy was just the power of trusting your own abilities and protecting them. Because when he was at Bell Labs and had invented the electret microphone, they said, all right, Jim, are you ready to pack it all up? I guess we won't be seeing much of you anymore. And he was about 30, let's say, at the time. And he said, why would I leave? Where would I go? This is the best place I've ever been in my life. I have all the funding I need, and I'm surrounded by these incredible scientists. Why would I leave? And they're like, well, this is a milestone breakthrough. This is, you'll be rolling in dough. And he just said, but for what? I would rather be here. And so while there have been so many technological advancements that have resulted in him staying, I do think that it's important at every turn to recognize and understand the true value of your contributions to society and ensure that they are protected and that you have the best strategy to move forward. And that means that you should rely on the network that you've created of trusted advisors. So I think that surrounding yourself, or making the effort to surround yourself by people that have been or are able to see around the corner and to advise you and to have faith in what it is that you're bringing to the table, critical elements that I certainly have learned from his experience.
Absolutely. Couldn't agree with you more. The journey of an entrepreneur is difficult already. And if you have the Council of 12 to help you, give you that 360 feedback, you really don't always know what the fidelity of your accuracy is in terms of observation. So
Well
with that,
said.
I've been joined by Ellington West, who is the CEO of Sonavi Labs. Thank you for joining today.
Thank you.
If you've enjoyed this episode, take a moment to rate our show on any podcast platform that you listen to. Scroll down to the bottom and push 5 stars. It's that easy. And as always, thanks for listening.